So I think there's a emerging understanding in oncology as a whole that the less side effects we confer to a patient with the treatments that we deliver, the better off the patient is. There was a very big study that came out of Boston recently in patients with lung cancer, actually, but patients with stage 4 disease. These are not patients who are getting radiation. They were just getting standard of care chemotherapy. And the one difference was half the patients got standard of care chemotherapy. The other half patients got the same chemotherapy, except they had better supportive care. So they had supportive care appointments from the very beginning. And they were really surprised by the results. The results came out that the patients who got this supportive care lived longer, which was a complete surprise to the oncologic community as a whole, because they were getting the same treatment. It's just that the so-called palliative care was brought into the fold at the very beginning. And one theory about why this study showed this surprising result was it did a better job of managing side effects and improving quality of life. And if you improve quality of life in your patients, not only are you helping them live longer, but you're helping them live better. And so protons, in some ways, is exactly an evolution of that concept. It's the natural evolution of that concept because you're better sparing surrounding tissues. Protons don't carry with it a much more potent destructive force than X-rays. It's very similar to a 5 to 10% degree of uncertainty, very similar in terms of its ability to destroy cancer cells. Where protons have benefit is reducing dose exposure to the surrounding normal tissues, and that translates into an improvement in quality of life, in a reduction of toxicity, and this benefits any cancer patient. And this is broadly applicable across all disease types. There's very few patients who would sign up for a treatment given a choice that's going to confer a greater amount of side effects versus fewer side effects. And that's where protons can potentially really benefit our patients. Now, we still need to provide evidence that this is indeed the case, but we're doing so. The proton community is very much rallying around this concept of evidence generation. 80+% of patients treated with proton beam, their data is gathered and monitored in a registry or in a prospective trial. So we're trying to put this information together. And I think ultimately, the goal is to identify the patients who are going to benefit the most from this technology.